This toxic drug crisis has affected almost virtually everybody, either directly or indirectly.
Heroin is very, very, very hard to find. It is a thing of the past. Everything now is fentanyl. Even the fentanyl is mainly not fentanyl. They're putting animal tranquilizers in it. They're putting benzos in it, lots of benzodiazepines. The toxicity of this drug is so severe nowadays that even just a little speck will put you into a coma and you will be in an overdose. Just a little speck of it if you don't have a tolerance to it. Drugs is just Russian roulette now.
The role of a firefighter has dramatically shifted because of this drug crisis that we're facing. Over just the last 5 years, we've seen our percentage of medical calls skyrocket. 60% of the calls we attend now are medical calls, and a lot of those are associated with the unhoused, with the drug toxicity problem that we're finding in the community. And the impacts on the health of the people taking these drugs is dramatic. Whether they recover from their overdose, there may be long-term damage that was caused just from the overdose itself.
The substances keep changing. What was taking place is that there was a veterinarian sedative that was on the street that people were consuming. What was happening basically is people would just be zombies.
We start to get to know folks that are living out in the community quite well. Know them on their first name basis, know a lot about their history, know a lot about the challenges that they're facing. And I think one of the things that really frustrates our officers at times is not being able to quickly guide that person in the right direction and connect them with the right service at the moment that that person needs it. The way that the system currently is, lots of times it's a rare circumstance where you can get that resource for that person at that moment in time. If there's a delay, if there's challenges in navigating the system to get to that, chances are that opportunity has now been lost, at least for a while.
There's a lot of wait times to get into treatment facilities. Some are open, some aren't. We need to work better as a society, and we need to kind of have all different approaches. There's harm reduction, and there should be treatment. There needs to be enforcement. There needs to be prevention. We need to have all these together. Not just one approach is going to work. And I think the pendulum right now is focusing on harm reduction, and maybe we need to look at the broader spectrum of what services we can provide everyone.
We need to start preventing future crisis as much as we possibly can. And that's like providing the supports and services that people need when they need them, right? Having an immediate impact in someone's life is ideal, right? Like for instance, if someone is first-time homeless, if you have the ability to kind of connect with an individual and have a suggestion or somewhere for them to go where it's safe and they're not subjected to, this demographic or people using all the time, they're less likely to start using substances.
I think it can get incredibly heavy. I do think that we do a really good job of highlighting success stories and really amplifying the good work happening. But the flip side of that is we are constantly working in trauma. We are witnessing deaths. We are witnessing people that we care so deeply about. And we've had the honor and opportunity to spend our time walking alongside them with their journey. And then it ends with their death. It definitely takes an emotional toll on everyone involved in this field.
The holistic approach would say we need to address what's the cause of the addiction. Well, again, that's different for everybody, but I'm thinking of this girl right now specifically, and I think I met her when she was 22, and she had told me that when she was 16, she had been in about 12 or 13 foster care homes. So now she's living in addiction. Well, what are you going to do to address her addiction? Well, you can't just address the addiction. The addiction's not the problem, in effect, right? There's a problem prior to the addiction that needs to be addressed. 13 foster care homes tells you she's never been loved. She doesn't know what love is. She doesn't know what security is. She doesn't know what acceptance is. She doesn't know what affirmation is. And then, of course, the sexual abuse starts with the pedophilic older uncle, right? And then that's not an uncommon story. And so now you have to deal with that. How do you deal with that? As a pastor, I've had to talk to a lot of church people about this. Why do they, turn to fentanyl, and why do they turn to drugs? And my answer is, do you take Advil when you have a headache? Yeah, I take Advil when I have a headache. Well, now you know why they use fentanyl. It works. It's the thing that can address a horrific memory.
The help that is available is very, very difficult to navigate for an entrenched person that is living in a tent, doesn't have a cell phone. How are they supposed to call detox every day? How are they supposed to get from one side of the town to the other to meet the doctor at 2 p.m. when they're sitting in their tent dope sick from fentanyl, and they have to do that doctor's appointment in order to get the referral to go to King Haven. It takes weeks and weeks and weeks and weeks for all of this very difficult stuff to happen.
We need more treatment centers in our own communities, because a person that's experiencing homelessness and drug addiction in Abbotsford, when they decide on a Friday afternoon that they would like to go to treatment, that's the decision they want to make, they can't wait for Monday. They can't wait to 2 Fridays from now. That opportunity needs to be there for them right then and there to go to treatment.
In Calgary, they have a detox where couples can go. There's not one in BC. So I know couples that are afraid to go to detox. Her wife will go to detox, and her husband will stay home and watch the house. She'll get out of detox, come home, while her husband's still using. It's almost impossible for her to stay clean.
Access to detox is something that needs to be taken a lot more seriously. I do feel the barriers sometimes get to be too much, and people are more willing to give up or stop trying to access the same thing over and over again when they know that the result is always no. I think the bottlenecks in various systems create a real sense of hopelessness. And I think a sense of hopelessness is really damaging when people are already struggling to have their basic needs met. And I think it leads to incredibly destructive outcomes.
Creekside Detox is in Surrey. That's the only detox that we have from Hope to Delta. It's like a 2 to 5 week waiting period to get in there.
We actually have a guy who's in right now. We have Narcaned him more than any other person for the last year. And I genuinely thought, I cannot imagine this guy making it. And he has detoxed himself, and he is now 5 weeks clean. He did it here with us because there was no way to get him into Creekside. And it's an absolutely remarkable story of someone who just kind of went, I just need to do this. There's no other way to do it. And he did it on his own, and here he is 5 weeks. So now what we want is for this person to sustain this sobriety and maintain the course of recovery. So what are you going to do with this amount of people who need housing? There's always a number of beds available on a weekly basis that we're all trying to clamoring to get, 20 people into this 2 beds, and shelters are full, and people just feel stuck in the hopelessness of where am I ever going to live? I might as well just stay in the shelter. And what makes staying in a shelter a little easier is continuing on in my addiction, because this just sucks.
There's no second stage, unfortunately, right? Like, I have a lot of people that will say to me, I'm scared. I don't want to go to treatment. I don't want to do all this, and then not have a home, and then have to go back to the shelter system, right? Which is reasonable. I get that. So unless there's someone out there, like family connections, or, like, it's really difficult. It's really, really difficult.
We have to have a much broader, holistic approach. And if we're not investing in that, we're just going to continue to be spiraling and spending money on cleanup and really not accomplishing anything. But more importantly, you've just left people to fend for themselves and without the supports that they need.
In order for these tools that have been created, like the housing or the harm reduction or the treatment facilities, in order for all of these things to function and work properly, there needs to be a complete overhaul and questions of, do we want these individuals to stay in addiction? Are we going to support them through their addiction? Is there going to be a purposeful direction that all of these systems can work together to get people the adequate mental health help, physical health help, and addiction help that they need?
If someone is in crisis and they're looking for supports and they've called one agency and that agency says, sorry, you don't really fit in our box, you're gonna have to call so-and-so. And then that person has to repeat their trauma again. And then, oh, sorry, that's not the right place. And then you have to call another place. And this is the problem too. The process is quite a lengthy process. Detox Now won't even take an individual unless they've got something already lined up. So there's one barrier. They cannot call Detox Now to refer themselves, which is also another barrier, right? Folks used to be able just to call Detox and say, hey, like, I'm ready. I need to get off the street. I'm ready to get clean. Like, what can I do? Now, if someone isn't using opiates and only using stimulants, Detox doesn't consider that to be a life-threatening substance. I don't want to say it's impossible, but it's really, really hard to get someone into detox. Their drug of choice is stimulants. So this is kind of what we're going through in terms of, like, how do we navigate through our system? We can make it so much easier. I really do wish that we had some sort of, program in terms of folks that might be active in addiction and been inside for a while, don't have a tolerance, and then they're released without a plan. Just recently, we lost a gentleman just shortly after he was released from the system.
After people have gone through the process of accessing treatment and they've gone through detox, I think there's a massive need for that aftercare. Like, yes, I've gone through treatment, but now what? Who can I access to walk with me through the things? Who can I access to go out and experience life with these new eyes and this new person that I have become and worked on to become through treatment? I have to do it by myself? I think it would be really beneficial to have peer support programs that can connect people after they've gone through treatment.
I think to make any meaningful change on the ground, there needs to be a range of holistic interventions that target people and support them at various stages in their lives. In an ideal world, I would love to see more interventions that can happen in early childhood for individuals who have experienced trauma at that time. I would also love to see increased access to substance use supports. And in a perfect world, I would love to see some of those supports be outside of the formal health system. I think there is a lot of power in the work that we can do at the community-based level, especially when we come together.
Nobody is born into this world saying, I want to be addicted. I want to be doubled over on the side of the street, making a mess in community. Nobody starts that way. So I think it's contingent upon us to also understand that there has to be a more holistic approach to some of these challenges. You can't just wash your hands of it and say it's somebody else's problem. It's everybody's issue, because these, at the end of the day, are our family members. They're our neighbors. And if it hasn't affected your family yet, hold on tight, because when it does, it hits like a ton of bricks. I know from experience.
I think for a lot of people, encampments and the homeless population become synonymous with substance use, with mental health, with the challenges that go along with that. In a lot of ways, that impacts members of the community in kind of one of two ways. Either they've had an experience with somebody that they believe is living rough in the community or suffering from a mental health concern or an addiction issue, that they've felt unsafe, or just seeing those things visually causes people sometimes to feel unsafe. And particularly because we see so much of that activity taking places in sort of key areas of the city and key business areas of the city, that causes sometimes people to think, hey, do I want to go to the businesses in that particular area?
As we try to address this issue over the last decade, we see the numbers of homeless go up. We see the number of toxic drug deaths go up. And so whatever we were doing or have been doing hasn't been working. We're a decade into this crisis and we still don't have enough detox beds. It still hasn't been addressed. And supports for youth and the youth workers. Because once somebody has hit adulthood and they're entrenched in homelessness, it's much more difficult to address those issues. And really, by not addressing those issues, you're condemning people to an early and oftentimes painful existence and an early death. Folks that are on the front lines understand the complexity of the challenges. They're the ones building the relationships, and yet oftentimes they don't have the resources and they can only do so much. We decided that why don't we actually take a look at getting the research, and then that research actually gives us the information that we're needed. When the senior levels of government try to impose a one-size-fits-all, and they're not listening to what would work in a community and what wouldn't, that can be problematic. These are challenging, complex issues. And if we don't, as a society, realize that there has to be a better way, then we'll just continue to repeat ourselves. And there's no easy answers, but I think understanding what our roles are, supporting the folks that are on the front lines. There's so many good organizations in Abbotsford that get it, and we are trying to address that through Access Abbotsford. But it's like most things, there is a component of the funding that has to come from the senior levels of government. Don't try to micromanage us. Work with us. And that's, I guess, my ask.